We're wanting people to be aware that Dr. Francis Brinker is about to present the first talk for the morning. Welcome to visitors, attendees, members of the eclectic community, and the reps, and everyone else, and everyone that's going to be seeing this on YouTube. It is my privilege to introduce an upperclassman of mine at the times of my studies in naturopathic medicine, Francis Brinker. He was our clinic director, and I truly think he's one of the most brilliant minds in botanical medicine in North America, if we're just going to limit it to one continent. But I think you're going to find in the two talks that he presents that that was an understatement. So I'd like you to all welcome Dr. Francis Brinker.
Now, in an attempt to live up to that introduction, I'll flesh it out a little bit. I was a student at NCNM from 1977 to 1981. I was in the entering class with Dr. Ed Allstadt, who was licensed registered pharmacist at the time, Dr. Andrew Rubman. We all started out in Wichita, Kansas, and graduated to NCNM clinical experience in Portland, Oregon. And one of the beauties of transitioning to Oregon was not only that we existed in an actual licensed state where naturopathy is legal and naturopathic medicine can be practiced without fear of jail time. We were also introduced to eclectic botanical medicine, and through the botanical medicine courses taught at the time by Dr. Bruce Canvasser, who had learned from Dr. William Turska and Dr. John Bastier, but primarily Dr. Turska here in Portland. He shared with us a legacy and a heritage which I had been completely ignorant up to that time. As it turned out, I would have to say that the eclectics became my heroes. They were the ones who inspired me to go on and try and learn and advance what knowledge we had at the time, which in retrospect was relatively primitive based upon what we now know. But it was an inspiration to be on the frontier, to advance the theory and practice of medicine, understanding, applying naturopathic principles with natural therapeutics, and really experiencing what turned out to be a never-ending learning process. I think that is the best of life, is when we continually grow and learn and evolve. And so the eclectics were a real inspiration for that, through their development of botanical medicine. Consequently, after I moved to Arizona in 1985, Dr. Allstadt asked me to help develop some literature to help keep current the knowledge that the eclectics had handed down, while also adding to that with modern scientific research. So I always thought that was an important aspect of learning and developing, was balancing the tradition that we've received with modern research and investigation, so that we can continually expand our understanding. Part of maintaining the tradition was compiling a number of eclectic medical journal articles into 2 volumes in 1995-1996, which we titled the Eclectic Medical Journal reprints. And someone's phone?
Oh, I'm sorry.
And
my only charger is in the computer.
In the 6 issues each year, 4 of those issues were devoted to 1 decade of eclectic practice, and we started, I believe, with the 1860s and skipped around back and forth, but we covered 8 decades of articles printed by the eclectic doctors in which they shared their clinical experience and especially their experimentation with botanical medicine. This is how medicine developed and evolved. It was with an honest sharing of both the application and the effective application and the limitations in clinical practice of these different medicines. So it's not something that you see such honest reporting these days about outcomes as they were able to do then without fear of legal retribution, let's say. So compiling those articles was very interesting. We also had several special issues, one on alteratives, one on medical controversies, and then a compilation of Dr. John Scudder's works on organ remedies, which was the final issue. But compiling that information from the past helped make it current, bringing the old knowledge into our modern days. And also, the other inspiration behind my interest in eclectic medicine was John Uri Lloyd, who really was foundational in the advancement of eclectic practice through eclectic pharmacy. And that's going to be the focus of my talk today. And I compiled a lot of his observations, writings, and conclusions in a book called Complex Herbs, Complete Medicines, in which I distinguish different types of preparations, the advantages and limitations of each. But I thought today it would be interesting to see historically how these different types of preparations were brought into use and the reasons why. Because things don't just happen accidentally, normally. We proceed with reason and purpose. And so it's very interesting to me that if you look at the development of eclectic medicine in this country, it proceeds along with the development of eclectic pharmacy and conventional pharmacy, and in tension with that development of conventional pharmacy to distinguish itself in ways that are pertinent to our current use of botanical remedies and dietary supplements. So that's what I wanted to focus on today. And in doing so, I think one of the means that will be helpful is to look at how botanicals were included and then eventually excluded from the United States Pharmacopoeia, which another good friend and classmate of ours, Dr. Wade Boyle, had documented with the botanical medicines in the United States Pharmacopoeias. So for any specific information on that topic, I'll refer you to his writings, which I believe are still available through Eclectic Medical Publications. And but I'd like to give a general overview about some of these developments. So the big question is, why eclectic medicine? Why does it exist? As I believe it was Dr. Hall, or I guess Dr. Bailey mentioned last night, the conventional medicine of the early 19th century was what we would describe as heroic medicine. They used extreme measures to intervene in what was usually catastrophic acute illnesses. And it generally involved standard procedures of bloodletting, vomiting with ipecac, purging with cathartics, particularly jalap. So some of these South American, Central American remedies that had been popularized in Europe were now coming back, carried through the European medical education in the United States. And they would also, in attempts to reduce congestion of internal organs, create blistering on the skin with items such as cantharides, the Spanish fly or croton oil. It was such extreme and painful medical practice that people generally avoided the doctor until it was time to die, and then very often he would finish the job. And so salivating with calomel, mercuric chloride, was a favorite way of causing the body to react and expel. They thought that these means of stimulating the emunctories, the organs of elimination, would help to remove whatever disease-causing entities may be involved in the process. So it was in response and reaction to that Dr. Worcester Beach decided that he needed to step in and introduce a new approach to what had been conventional European practice, the people that they called the regulars. And Worcester Beach, even before he became a doctor, he began pursuing knowledge of American medicinal plants by applying as a follower or student of a New Jersey herbalist by the name of Jacob Tidd. And at first he was repulsed because, as herbalists are wont to do, they don't always like to share their knowledge, or they function independently without a need or a desire to have to explain their ways to someone else. But Worcester Beach was so persistent that he was eventually accepted as an apprentice to Jacob Tidd and learned about the American medicinal plants under his instruction. What he wanted to do and was interested in doing was incorporating these American medicinal plants into conventional practice, which was beginning to occur anyway within even conventional medicine. The first United States Pharmacopoeia, which was the official compendium of official medicines, authorized medicines in this country, was published in 1820. And it's interesting that it included a number of American remedies, including Datura stramonium, Lobelia inflata, Nicotiana tabacum, Phytolacca americana, Podophyllum, Sanguinarius, Ulmus fulva, the slippery elm, and Xanthoxylum americana. With the exception of slippery elm, what you may recognize in those list of remedies is a lot of potential toxicity. Basically, the way medicine perceived drug plants was as poisons, and that medicine is a small dose of poison. That's how they viewed the necessity of potency and power in medication. You wanted to be able to force reaction in the patient by the action of the medicine. So Worcester Beach, he decided that this wasn't the optimal way of regaining health, of supporting normal function, that he went with gentler remedies and looked to introduce some of those into practice. And so he developed what became the Reformed Medical Society in 1828 in New York, and then the Reformed Medical Academy again in New York in 1829 to help develop this new approach to practice and utilize some of these less toxic, more subtle remedies, American botanical plants especially, developing the American Pharmacopoeia. So in 1833 then he published his book, The American Practice of Medicine. So to give the 2 points of emphasis of why eclectic medicine came into being, it was twofold. One, it was medical reform. He wanted to change medical practice, make it less heroic, more adaptable to people who didn't have to suffer through the process of treatment, and thereby could actually regain their health more completely as a result of that intervention. The second aspect was it was an American form of practice. As I mentioned, the medical doctors in the United States at the time had mostly been trained in Europe, or many of them. They had a medical college in Philadelphia at the time, but the more prestigious education was thought to have been European in nature, which did not deal with American plants as such. Some of the South American plants that had been imported to Europe centuries before were utilized, but not North American plants. And so a big influence on that approach and on Beach was Constantine Rafinesque, which Dr. Haller mentioned last night, as a naturalist who traveled the highways and byways and backcountries and hills and dales searching for new medicinal plants and writing about them. And his belief system was stated as every medicinal plant is a compound medicine prepared by the hands of nature. And that for each native plants of any region was put there and intended through nature, through God, is however you want to understand it, to treat that region's diseases. And this was had always been part of traditional herbalism and a lot of the Native American understanding. You look for the remedy in the area where you find the disease. And so that was part of the motivation for Beach to develop the American Materia Medica and start to promote this and teach this in schools. Now, the competition at the time was, well, I was mentioning the United States Pharmacopoeia, and the different types of preparations listed in 1920 were syrups, tinctures, acetates, which are vinegar extracts, juices, powders, infusions, and decoctions. These are the same types of preparations that were typically used in domestic medicine, or what might be called folk medicine. Very simple, non-professional types of preparations, but their preparation, the process of preparing these for each of the plants in the primary list of the Pharmacopoeia were standardized with the Pharmacopoeia. It was basically just describing how medicine was being practiced there at the time. Very simple preparations. The one thing conventional medicine was beginning to develop, which was earning some great interest and following, was the isolation of the active components, particularly the alkaloids, in some of these very potent medicinal plants. So that this was seen as a great advantage. One of the biggest problems with the early preparations were they were very strong preparations that needed to be consumed. By strong, I mean concentrated botanical extracts as decoctions and teas, and combinations that were difficult to swallow. One of the biggest problems with treating patients was getting them to consume the medicines because they were so distasteful. Many of these, especially the alkaloidal containing herbs, were extremely bitter. And so what they found was that the German and French scientists were able to start isolating the active alkaloids, beginning with morphine in 1804, followed by strychnine 1818, atropine 1819, quinine and caffeine in 1820, nicotine 1828, and colchicine in 1833. So all of these were serving an advantage to the medical profession, where they could dose in small amounts and thus get better compliance from their patients. And so the eclectics were a bit jealous about this, though at the time yet they were not yet called eclectics. A couple of Worcester Beach's students at the Reformed Academy of New York were Dr. John King and Dr. Thomas Vaughan Morrow, who started the Worthington Medical School in Ohio, as Dr. Holler mentioned last night, and ultimately the Eclectic Medical Institute in Cincinnati. The other man, Dr. John King, turned out to be one of the foremost bedrocks of stability, knowledge, and inspiration within the eclectic profession, in an attempt to develop a concentrated botanical extract that mimicked the alkaloids and yet retained the complexity of a botanical medicine. He decided to experiment with some of his alcoholic extracts by pouring them into cold water, and noticing, and particularly in the case of Podophyllum peltatum, the mayapple root, that it developed a resinous precipitate on the surface, which he skimmed off. And he decided to test it on the next patient that came into his clinic. It was a young woman. He gave a dose that he estimated somewhere between 12 and 15 grains, which would be around 800 milligrams to a gram, and was very disturbed to observe her reaction. He almost killed this poor woman, had to care for her for about a week. She developed extreme gastroenteritis, a lot of purging and pallor. It was a definite clinical poisoning, and it was so shaken by that experience that he avoided experimenting further for another 8 months, when he started using more reasonable doses, somewhere down around a grain to a half a grain, which would be 30 to 60 milligrams approximately, and finding that yes, this Podophyllum retained great potency, while it also had a variety of what were considered at the time desirable effects, which was a great cholagogue effect of releasing of bile, which led to then an effective catharsis and purging. It also induced salivation, which was a primary desirable effect of doctors prescribing calomel, mercuric chloride. You'd get these patients to salivate, and that was a strong sign that their body was responding appropriately to the medication. So because Podophyllum could produce a lot of these same effects on the liver and salivation as mercury, it became known as the eclectic calomel and became a very popular form of eclectics, offering an alternative to this toxic mineral substance, which was given so often, so frequently, that people's gums would soften, their teeth started to fall out from being treated with the conventional calomel. So King then went on to use the same approach to develop a couple other effective resinoid remedies, one of black cohosh and another with iris. But in his experimentation, he also learned that a lot of these resins that precipitated out from adding an alcoholic extract to a cold water solvent were inert, were ineffective. He had published his results with podophyllum in 1844, and so people started picking up on this, particularly the pharmacist W.S. Merrill in Cincinnati, who was one of the major pharmaceutical manufacturers in what was then the West. And so they began to popularize these concentrated forms of medicine. Well, then as now, you have people who are less than scrupulous in terms of their motivation for producing medicinal or health-promoting substances, and they're really more interested in making a buck than making good medicine. And so what you had was a lot of people producing these resinoids from herbs in which the resin was not an active component. And they would add various other mineral elements and various contaminants and adulterants. And the attempt at concentrating botanical medicines in this new standard form of a small dose, big effect approach to treatment really almost undermined and destroyed the botanical medicine practice, not only of the early eclectics, but also the physiomedicalists, who also were adopting some of these remedies. And it really undermined the credibility of a lot of doctors who were using what they thought should be, theoretically, potent medicines, but really had no effect. And in fact, King himself responded vehemently against a lot of these remedies. And after his authoring the first volume of the first edition of the American Dispensatory, which was a compilation of eclectic remedies in, it was 1852 or 55, someone, that was financed by another professor at the Eclectic Medical Institute, Dr. Newton. Newton was such a proponent of these resinoids, and King had become an opponent of those other than the ones that he had discovered to be effective, that it really led to the split between them and the start of a new school, which it had elements of, cannon on the front steps and locking of the doors and armed attacks on the schools. It's a very colorful age, but as you well know, the 1850s were a very disruptive time and led to a lot worse firepower than a simple internecine rivalry on the steps of a school. The interesting thing around this time is to observe how some of the medicines changed in the USP as well. And I just want to mention too, as an aside, as far as King's podophyllum resin, it was retained into practice up into our modern times, in as late as the 50s, and one of the major components of that podophyllatoxin was eventually developed into semi-synthetic etoposide and teniposide, which are two of the major chemotherapeutic agents still utilized to treat cancer. So we're talking about very powerful drugs, but the eclectics wanted to maintain that complexity which distinguishes botanical medicine from pharmaceutical isolates, the heavy drugs in which much greater toxicity is associated with not only concentration but purification and isolation. So by 1850 or 1840, the list of types of preparations in the USP for their primary list, which was 88 herbs in total, included 23 infusions, 11 decoctions, 47 tinctures, and 19 solid extracts. So it's still basically a lot of the primitive forms of medicine, but the solid extracts were becoming popular and being incorporated into medicine. What developed then, especially with W.S. Merrill in Cincinnati, was an attempt to try and create a standard form of medicine that was consistent from one remedy to the other, so that doctors could easily assess proper dosage and prescribe effective, concentrated forms of liquid medicine. Advantages of liquid medication is that they're easily combined to produce a formula that's specific for a patient. But the problems with so many of these tinctures is that they were highly variable in their potencies based upon different strengths of solvent to crude drug. So what developed out of that was the fluid extract. Rather than using maceration of an herb in an alcohol water solvent of different proportions, which would extract some of the active components, but with diffusion you're always leaving the same concentration of active components in the marc, the extracted material, as it goes into solution. They decided that through percolation in a column they could exhaust all the active components from a plant by dripping alcohol from the top of a column through an herb and collecting that extraction at the bottom. And they would do, for every liter of extract they wanted to produce, they would usually put about 800 milliliters through, set that aside, and then extract the rest of the marc to exhaustion, concentrate that by boiling it down to a total of a volume of 200 milliliters, and combining that with the 800 milliliters, so that for every kilogram of crude drug you would end up with a liter of extract. And that was equivalent to 1 gram represented in every milliliter of extract, or 1 grain, which was a standard prescribing amount, 65 milligrams per drop of these extracts. And so because this was a standardized process, it was the same for all the plants. It was a consistent dosing amount where you could figure on the basis of your knowledge of the proper dose for the crude drug an equivalent dosage for the liquid extract, and liquid extracts were much easier to dispense and administer. That this was a wonderful new development process, in theory. So that was introduced in the 1840s, so that by 1850 you saw the first inclusion of 7 fluid extracts, whereas the rest of the types of preparations were basically the same. So if you look at the tinctures by 1860, there was 46 tinctures that ranged in strength between a 1 to 5 and a 1 to 10 extract, and 25 fluid extracts, which were 1 to 1. So you can see that the fluid extracts were anywhere between 5 to 10 times stronger, and by 1860 about a third of these liquid extracts were now in fluid extract form compared with the tinctures. An interesting development occurred at that time. There was a pharmacist in Philadelphia who happened to be also the mentor for a young John Uri Lloyd who was apprenticing with him at the time. John Uri Lloyd's story was he came to Cincinnati as a 12-year-old and worked under German pharmacists for about 3 years, in which time he memorized the United States Pharmacopoeia and United States Dispensary. Which are no small books. For a teenager, that's pretty good feat. And so then he went to work for the largest pharmacist in town, this Gordon. Well, Gordon used to drive by the Procter & Gamble plant along the Ohio River and noticed that while they were rendering the fats to produce soap and candles, that there was a pipe running off this sweet water into the river. The glycerin backbones for fats, as you know, triglycerides are 3 fatty acids attached to a glyceride molecular backbone there. They were just, keeping the fats and dispensing of the glycerin. And so Gordon got an idea. He went and asked him, can I take that off of your hands rather than just pouring it into the river. Would you mind if I put barrels under your pipe there and collect this material? And he said, sure, knock yourself out. So he was driving this stuff away by the wagon load and purifying it and developing some of the first source, the only source in the West of glycerin, which you're all familiar with here in this country as being a sticky, thick, syrupy, very sweet substance. It so happened that in the year 1864, the American Pharmaceutical Association was holding their national meeting in Cincinnati, and the keynote speaker was William Gordon. So he gets up and he describes all of the wonders of glycerin, all of its advantages, some of which were it acts as a solvent for a number of chemicals, a very effective solvent. It doesn't freeze. It wonderfully flavors a lot of bitter medicines which are otherwise unpalatable. And so he made such a strong sales pitch there that the glycerin was almost a necessary component of any effective and desirable medicine that by 1870, of the 46 fluid extracts in the United States Pharmacopoeia, 33 of them contained glycerin. So this is 6 years after his talk. He was also elected president of the American Pharmaceutical Association after his little talk. So it was quite a sweep for Mr. Gordon. He was a real entrepreneur and knew to strike when the iron was hot. So it was also an interesting experience for his young apprentice, John Uri Lloyd, of watching that whole process. But as a consequence of this introduction of glycerin as a solvent and sweetener, it kind of led to what Lloyd later described as the elixir craze. And that was the time when you had these patent medicines with secret formulas and medicine shows where people would travel around selling their miracle cures. And two of the biggest components of these miracle cures, besides a variety of assortment of herbal extracts, would be glycerin and alcohol. Now, some people say that some of the most potent effects of these medicines was the alcohol content, and certainly the glycerin helped in their consumption. But in various fluid extracts, elixirs, syrups, the glycerin became a very important component until people discovered that maybe finally, based upon their experience, it wasn't quite the optimal solvent that it had been put forward as being, and so that you see a gradual diminishment. As I said, 33 of 46 fluid extracts in USP in 1870 contained glycerin. But by 1890, only 16 of 88 contained fluid extracts. In 1870, whereas you had 47 tinctures there along with the 46 fluid extracts, by 1880, it had moved on to 79 fluid extracts and 71 tinctures. By 1890, 88 fluid extracts, 73 tinctures, 34 solid extracts, 4 infusions, and 2 decoctions. So there was this huge transition that occurred between 1860 and 1900 in terms of conventional pharmacy, of this move towards concentrating liquid extracts, developing solid extract concentrates, getting away from these home remedies of water extracts, your infusions and decoctions, and basically trying to standardize the types of medicine, so that every medicine was basically the same, no matter what herb it's produced from. You could estimate its dosage strength and potency of utilizing either the fluid extract or these tinctures or solid extracts. And a lot of that had to do with a man by the name of Charles Rice, a good contemporary and good friend of John Uri Lloyd, who attempted to bring the American pharmaceutical industry into a bit more strict compliance with quality and an assurance that these medicines were effective. Well, all of this seemed well and good to conventional medical practitioners, but what about the eclectics? I last left you with their struggling to survive the resinoid craze and their utilizing these really relatively poor quality solid extracts and starting to incorporate fluid extracts along with conventional medical doctors. What was actually distinguishing them from anyone else? Not that much. The school, we're talking about the 1850s, early 1860s. We had a little thing going on known as the Civil War, and Cincinnati was not in the middle of the fighting, but certainly people were picking sides right there at that border state. And so many of the young men who had been inhabiting the halls of medical schools were now off fighting in the fields of battle. Eclectic Medical School and Medical Institute and the other eclectic college in Cincinnati that was formed by the people who had rebelled against the whole concentrate and resinoid phase decided that if they were to survive, they were going to have to get back together. So that brought John King back to EMI. Another important individual that is critical for understanding eclecticism and eclectic preparations was the 1856 valedictorian of the Eclectic Medical School, a man by the name of John Milton Scudder. And Scudder became important because by 1862 the school was about ready to fold. The Eclectic Medical Journal, which was its voice piece and kind of the standard bearer for the profession in the field, was failing. The school didn't have enough applicants and the quality of medicines were pretty awful. Scudder bought the school. He was a successful practice in his 6 years in Cincinnati, bought the school, bought the journal, and then began to transform the profession through his insights in clinical practice into what makes good medicine and good medical practice, based upon the eclectic principles that treat kindly and gently, but effectively, and utilize whatever method is going to be most effective. So what Scudder did was introduce the concept of specific medication, which is a term I assume most of you are familiar with. But what he did is, as a genius that he was, he adapted different aspects of other medical approaches, including, and I'll get into this a little more later if someone else doesn't already cover the material, Chinese medicine using the eye, pulse, and tongue as indicators of organ system functions on which to base your prescriptions, because Scudder was a firm believer in clinical examination, evaluation, and basing your prescription on science. For the most part, Scudder got most of his inspiration from homeopathy, which had just been developed in the 1830s, but was really growing in popularity not only in Europe where it's founded, but especially in the United States, because it offered, again, a very non-toxic approach to treating disease in great contrast to the regular practice of medicine here. So what Scudder did, he looked at the homeopathic approach and noticed a few things that really appealed to him. Number one, they used extracts of fresh plants. They used, however, very dilute extracts, 1 to 10, 1 part fresh herb to 10 parts solvent. Now consider the fact that an herb is up to 80% water volume in and of itself. You can see that by adding that to a very weak form of tincture, it's going to reduce the concentration of active components, but yet the homeopaths claimed that it was the vitality of the plant that was transferred in this less concentrated extract that gave it the greater actual potency, living potency, that there was something of the power of the living plant that was able to be transferred into fluid form by using the fresh versus the dried plant. And so Scudder liked that concept, but he didn't like such a great dilution. So he went from a 1 to 10 extract of fresh plants to a 1 to 2. And the beauty of using the fresh plants was that, based upon his instructions to doctors in the field, we're talking again mid-19th century. The frontier was not very far west of St. Louis at that point, and most doctors in family practice, general practice, small towns they didn't have a local pharmacy to send their patients to. They very often had to produce their own medications or order them from some house back east and wait. The beauty of Scudder's approach is that doctors could go out and into the field themselves, harvest fresh plants, add the alcohol, and within a short amount of time have a good quantity of their own fresh medicine of the quality that was determined by their own processing. So that was one of the things he borrowed from the homeopaths. The other things he really liked, unlike a lot of the conventional medicines that combine many different herbs in which a lot of times there were incompatibilities of one medicine interfering with another, or chemical incompatibilities in which precipitates would form and reduce the potency of these medications, that he believed that each plant was a complex remedy in and of itself because of all of its various active ingredients. So he emphasized prescribing one remedy at a time, optimally. There was always room for people to adapt that, but the rule of thumb was one remedy. And then the last part, as I mentioned, his emphasis on clinical signs. He says the problem with homeopathy is they prescribe based upon symptoms. He says they ask the patient what's wrong with them, and the patient tells them, and they prescribe accordingly. He says with patients, you can't believe patients. They'll always tell you what they think you want to hear. He says, as a professional, you must rely on your own diagnostic acuity. Do a thorough examination, a complete examination, and based upon your clinical findings, you prescribe accordingly. And thus it was. And the interesting thing about with Scudder too, he said the clinical effects, he started documenting these through reports to the medical journals in which doctors would share their clinical outcomes by prescribing for different conditions, so that they were able to develop and refine the presenting symptoms which were indicative of a particular remedy. And so those the symptom constellation was described as the specific indications for the remedy, which was the specific medication. You matched the medication with the indications and you got outstanding therapeutic results. And that was the basis then for the recovery and renaissance of eclectic medicine, was this new system that was introduced by Scudder. He published his book, Specific Medications, in which he documented the indications for these remedies. I believe it was 1872, and then the next year or so, 1883, 73, 74, he came out with the book Specific Diagnosis, which led doctors step by step through the process in which you examine a patient thoroughly to determine what indications the patient is presenting with, thereby allowing you to select the remedy which was most specific. And so this was all tremendous. It allowed eclectic doctors a rational means of effectively treating disease. And that was the other point that Scudder wanted to make. He said the problem with homeopathy and their similitude, they give their medicines to healthy people and see what symptoms they develop. He says their theory of practice was entirely different in terms of prescribing according to similars. But he says you can't go on the basis of effects of medicine in healthy people as to what to expect in diseased people. He said we're only interested in the effect of medicine on someone who's sick, not on someone who's healthy. And in many cases, a medicine will have no effect on a healthy person, but have a dramatic effect on the sick person because they have the indications that are going to respond and react appropriately to that medication, whereas the healthy person is going to be relatively unaffected. And for the same reason, eclectics have always argued strongly against any animal experimentation with herbs. Animals aren't sick people. They're not even people. Why go there? It was not only a waste of time and effort and good medicine, but why torture the little animals? There was no need. So that was one of the early things that eclectics and naturopaths had in common, this anti-vivisectionist belief in if you're studying health and the effects of therapeutics on people, you want to study them on people and not on some other innocent species. So given that system, Scudder was having a great response and eclectics were having great success. And Scudder and John King used to hang out at Gordon's Pharmacy, talk, people would stand around the pharmacy talking shop, and they learned about this young 22-year-old, now no longer apprentice, but pharmacist John Uri Lloyd from his employer, and they were able to entice him away from the successful business into helping develop eclectic medicines. And that was really what ultimately transformed eclectic medical practice, because not only had they developed an appropriate system now for using botanicals to treat disease, but they had a recognized and confirmed genius who would optimize the quality of these medications. So at the age of 22, John Uri Lloyd went to work for H.M. Merrill, who was the eclectic pharmaceutical house in Cincinnati at the time, and within 10 years he and his brothers had taken over proprietorship, and they were given the sole and exclusive right to utilize the term specific medicines on their preparations. Now the advantage of having John Uri Lloyd signed on to the eclectic cause was that as a trained pharmacist he was well aware of how to make quality medicines. This business of throwing any fresh herb in a jar and pouring on twice the volume of alcohol as the weight of the herb and somehow always ending up with the most optimal medicine was, in his mind, nonsense. He says each herb must be prepared in a way that optimizes the effects and the extraction of the desirable components and activities of that particular herb. It had everything to do with when the plant was harvested, to how much it might be dried. They not only used, Lloyd not only used fresh plants, he also used what he would call recent plants, in which, for example, roots would be harvested and allowed to partially dehydrate. So while the root itself was still alive and if planted and watered it would still grow in the ground, that it was reduced its water volume content so it could be more effectively concentrated into good medicine. And so that was the other thing that Lloyd started developing one-to-one extracts as opposed to the one-to-two. He wanted it the most concentrated because his experience as a young child of being given some large doses of these herbal extracts that made him feel nauseous and sicker kind of imprinted itself upon his intent for the rest of his professional life, which he practiced as a pharmacist from 1860 until his, shortly before his death in 1935. So we're talking about, 1860. I say he took over the pharmacy in 1870. So it was 65 years as a professional pharmacist, during which time he was elected president of the American Pharmaceutical Association. He wrote over 4,000 articles on botanical medicine, received, I think, 3 Ebert Prizes for the best research in pharmacy, received a Remington Medal in around 1920 for one of the outstanding pharmacists in the country. He kept up great correspondence with not only W.S. Merrill, but Eli Lilly and Remington, and all these names, the outstanding pharmacists, were all his good buddies who he communicated with frequently. But he was very independent in his methodology. He developed pharmaceutically elegant preparations that were only sold to physicians and veterinarians and dentists. He wasn't into mass marketing for the general public. In fact, when he developed a hydrated colloidal aluminum compound to bind alkaloids so that he could effectively and rapidly isolate alkaloids like atropine, which was greatly needed in World War I, for example, for dilating the eyes for people who had been exposed to this toxic gas. He didn't want to be burdened with manufacturing a drug just to make a lot of profit. He was too into investigating, developing plant extracts and optimizing that. So he gave his invention to Eli Lilly so that they could do all the manufacturing and sales to the U.S. military and others who needed these drugs. He invented, as you know, the Lloyd extractor, which allowed the application of heat to the surface of an extract as a way of concentrating some of these liquid preparations without boiling them from the bottom and exposing them the entire extract to great heat, which often breaks down a lot of the active components which are extracted in fresh plants. Later in the early 19-teens, he identified in his studies colloids, which were non-precipitate types of molecules that existed in solution in relationship with one another, and it was very similar to what is actually derived from infusing herbs, but the difference being that he used low alcohol content to be able to preserve some of these glycoproteins, proteins, and polysaccharides that are precipitated out of solution in most botanical extracts. So for each plant, he would develop a method and a system and an approach that was specific for that plant. So rather than having standardized methodology that he applied to everything, he had unique individual methodology for each plant, which, as I believe, is what makes good medicine. You treat, as the Scudder's whole system of prescribing was prescribing to the individual, to their signs that are being expressed from their pathology. You prescribe specifically to them and their condition, not to a diagnosed condition. Doctors practiced as eclectics with their own inherent strengths and weaknesses, so that what one doctor may approach a condition or a patient one way, another doctor would approach it specifically as to how he could best address that. And so Lloyd treated pharmacy the same way. You don't treat all plants as if they're the same and equal. You respect their individual differences and make the preparations accordingly. So these colloids was an attempt to kind of maintain some of the values of the water-soluble components, as well as using higher alcoholic concentrate extracts for, resinous extracts, or even he would have multiple types of preparations for the same plant to get different effects based upon the solvency of the active components in those. So this kind of takes us from the 1870s, when Lloyd first came into the eclectic profession, to where he took it up to about 1920, all these different preparations. He was making, isolating some of the, concentrating some of the alkaloids, and making hypodermic, it's called subculoids, as in subcutaneous Lloyd extracts. He had the colloidums, the water-soluble components. He had the specific medicines, which were higher alcohol. But in all of them, they were very potent, very concentrated, so you'd only use small doses, which went back to Scudder's other aspect that he borrowed from the homeopaths. Whereas homeopaths used extremely dilute, to the nth degree of dilution of a remedy to get its effects, Scudder believed in using a small dose, but the smallest effective dose and the material dose, so that it could be repeated frequently in small amounts, as a way of using very potent remedies, which had the potential, a lot of them, for toxicity, but where the first signs of a maximum tolerable dose would express themselves, and you could stop the dosing at that point, because the doses given were so small, and then back off from there in terms of the frequency of the dose. So he was able to minimize dose, maximize the quality and potency of these herbs. And for Lloyd, potency was a function more of quality than quantity. He didn't consider that concentrating a remedy was the thing that made it better. It was actually a balance between the various components that exist in the plants with the more active parts that made it very effective. So just by comparison, all of these, he didn't have anything in the United States Pharmacopoeia except for one remedy, and that was his liquid hydrastis. It was a glycerin extract of golden seal, which he allowed to be published in the United States Pharmacopoeia because he felt he was getting too many complaints from people whose clothing were being stained by the alkaloid berberine, and he found that by removing the berberine, he would make a product called Lloyd's hydrastis that was a clear extract of golden seal that was still effective for treating topically and infections, on the mucosa in the eye, mouth, vagina, various other applications. So he did allow the liquid hydrastis, which is still produced here at Eclectic by to be incorporated in the USP. And of course, using glycerin as a solvent being superior for topical applications on sensitive, inflamed organs such as the eye or again, vagina, rectum, places that you wouldn't want to irritate or aggravate with exposure to alcohol. So Lloyd, and then the other thing about this whole elixir craze, he wanted to help bring that under control, all these secret remedies. He wrote a book on elixirs in about 1887, I believe it was, 83, that was then kind of standardized the process of effective manufacturing of these different combination remedies. And that was so popular with the American Pharmaceutical Association that in combination with the New York and Brooklyn Formulary, they used those two books combined to make the National Formulary in 1888, which became official in 1906, again, as a compendium of largely botanical remedies that were being moved as more and more synthetic drugs were made and being dropped out of the United States Pharmacopoeia. The botanicals were moved into the formulary, which was based not on novelty or potency perceived so much as on popularity. Those were the preparations that doctors were used and still continuing to use. So that as time went along, you saw a lot of the number of herbs being reduced in the United States Pharmacopoeia throughout the 20th century as more synthetics were being introduced. And so we see that in 1910 USP and 1916 National Formulary, there were 153 plants in USP, 137 in the NF, which included tinctures 61 versus 42, fluid extracts 47 versus 92, solid extracts 26 versus 13, syrups 15 versus 22. So you can see that the tendency there again is for more solids, more concentrated preparations in the United States Pharmacopoeia, and a lot more of the botanicals starting to move over into the National Formulary, so that the percentage of botanicals in the USP went from 44% in 1920 to 28% in 1940, 21% in 45, 12% in 1955. Finally, they reached as low as 8% in 1960, 5% in 1975, and 2% from 1980 to 1990. So all of this just shows that something happened there in the mid-20th century. And what happened was the death of John Uri Lloyd in 1935. What happened after that, his estate was dissolved. His son, John Thomas Lloyd, who had worked for the Lloyd brothers for years, started manufacturing these products because the company was sold, but the formulary for all of Lloyd's preparations, the colloidums, the specific medicines, was not in the vault of the company after it was sold. And then his son started another company in Cincinnati, JT Laboratories, and started producing medicines he called Lloydson preparations. And they were remarkably similar to the specific medicines and colloidums that had been produced by the Lloyd brothers, the company of which was now owned by an outside interest, Pennick and Company. It was a dry herb company from New York. So that raised some problems that were taken to court, and John Thomas Lloyd was prevented from further manufacturing anything that suggested that his preparations had anything to do with the Lloyd brothers. The Lloyd brothers continued to manufacture products in the 1950s until it was sold out to a German interest, Hirsch, and the company was moved from Cincinnati back to New Jersey. And John Thomas Lloyd never really recovered from the lawsuit. So the sad ending to this story is that for all of the wonderful work that Lloyd did in preparing and developing these preparations, it's lost. And I know Ed Alstad has attempted on a number of occasions to track down these books with the formulas through John Thomas Lloyd's sisters and various other relatives. No one seems to know where they disappeared. So the unfortunate thing is the specific processes that Lloyd used have been lost, but the good news is that the general concept still exists, that you want to use fresh plants, make the highest quality product for each individual plant, and to provide innovations in pharmacy. So when I continue my talk later this afternoon about how eclectic medicine kind of transitioned into naturopathic medicine, we'll carry on the discussion too then about how naturopathy adapted and adopted some of these eclectic remedies and then transformed them through the type of practice which emphasizes again a return to nature and its holism as opposed to this isolation, concentration, and purification that is typical of any pharmaceutical manufacturing outfit, be it eclectic or other. So I appreciate your attention and staying awake, and I'll move aside.